Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. If you have symptoms like irregular menses or absent menstrual periods, you're finding it difficult to conceive or are unable to conceive after trying naturally with your partner, or you experience hot flashes, which is sudden burning and warm sensations or perspiration, especially late at night, your doctor may have advised a luteinizing hormone test, also called the LH blood test, and today I'm going to tell you everything about this test. So what is the LH hormone or the luteinizing hormone? Well, it's very simple. Every time you have your menstrual cycle, around the mid point of your cycle, which is around the 12th to the 14th day, your ovaries release a single egg or ovum, and the hormone that is responsible for triggering this release is the luteinizing hormone. Its main job is to cause the ovaries to release the egg in every single menstrual cycle. It also has roles after releasing the egg. It also has roles in regulating the menstrual cycle, and in men it is also important for the proper development of the sperms. So its overall role is to maintain the fertility potential of each and every individual, and that's what its main job is all about. How is this LH test done? Well, this is a simple blood test. You have to visit the lab and they will insert a needle into the vein of your arm, draw a couple of ml of blood and process it in the lab and issue you a report with a value of your luteinizing hormone. It usually takes a day or two in most labs. Now, how do you prepare for this test? You don't need to fast, but if you're taking any kind of hormonal supplements or hormones, as well as any kind of vitamin supplements like biotin, it may affect the results. In women, it is important to do this test between day 2 to 5 of your menstrual cycle, and it is also usually preferred that you provide the sample in the morning, in the first couple of hours in the morning, to avoid variations. In men, you can provide the sample at any time. There are no such strictures on the day or the time. So what is the main reasons for which your doctor may have advised this test? Well, the first and most common reason is infertility. When you are unable to conceive naturally with your partner, your doctor will advise the LH test as a part of an extended battery of tests to check what exactly is going wrong. The second could be PCOS, which is polycystic ovarian syndrome, found in women. In this, there are increased levels of male hormones in the woman's blood. And this is associated with problems with fertility, irregular menses, hair growth on the face, and weight gain, as well as several other issues. So LH, the level of the luteinizing hormone, is usually found to be abnormal in women who are suffering from PCOS, in a large proportion of them, and so your doctor may advise the LH test if they suspect you have PCOS. The third is irregular periods, which could be a part of either when you are facing infertility, also in PCOS. The fourth is ovulation tracking. What we find is that when the egg is released, there is a surge in the level of luteinizing hormone or the LH, and this is the best way to track ovulation. So if you find a surge in the LH levels, there's a sudden spike in the LH levels around mid-cycle, that's when the ovulation has taken place. So some doctors will advise that you do the LH test to confirm whether ovulation was there. And the last is to check for problems with your pituitary gland. This is a gland in your brain which is actually responsible for releasing this luteinizing hormone, and any problem with that gland in your brain will show a corresponding problem or change in the LH level, and so we use it as a way to check for problems with the pituitary gland. What are some symptoms that you may have because of which your doctor may have recommended this LH or luteinizing hormone test? So irregular periods, infertility, hot flashes, which are sudden surges, or where you feel really very hot, you start sweating, your skin begins to burn, especially at night. These are very common symptoms. Weight gain is common. Low libido, you might have acne breakouts, changes in your mood, or hair fall. These are all symptoms which may be associated with changes in the LH levels. What is the normal range for the LH or luteinizing hormone in women? Here I have included the normal ranges for both premenopausal as well as postmenopausal adult women. This is only applicable to women who are more than 18 years of age. So between 18 and 45, you can see I have included the ranges for each of the 3 stages of your menstrual cycle. As you can see, the range is highest in the midpoint of the menstrual cycle when you have your ovulation or ovulation surge, which is between day 12 to 16. You can also see that there is a difference in the level after menopause. So these are the normal ranges in women. When will you find that your LH levels are higher than normal in your report? So there are these 4 situations. The first is PCOS. You may find a higher than normal level if you are suffering from polycystic ovarian syndrome. The second is ovarian failure, where your ovaries just don't work properly. They don't release the eggs. They simply stop functioning properly. This is called primary ovarian failure. The third is menopause. The LH levels tend to rise after menopause. And the last is precocious or early puberty. This may also be accompanied with higher than normal LH levels.